हेलो हाय.
Hello, sir. How are you?
आई एम डूइंग गुड. आप कैसे हैं?
So actually, good. I'm feeling good to have you back. So
थैंक
a while ago,
थैंक यू
I
सो.
think 6 months now. 6 months. It has been 6 months before we
प्रोबेबली
started
मोर
this.
देन.
Since we have, yeah, more than 6 months, I guess. So you are our
या.
first guest when we were organizing those episodes, no? So I wanted to have a live because hopefully I have discussed with you, know, about things we have been planning in the upcoming days.
गुड. या.
So we'll
वी
be
हैव
able
टॉक्ड.
to, yeah, we'll be coming actually to the audience. No, we are planning to come on live for as a series of discussions we might be having with physiotherapists. So we'll be discussing few things. So today we will just have a general talk, right? So as a friend, so we have discussed a lot outside of things. So today I wanted to have something in the professional way of physiotherapy, right, sir?
हेलो.
Yeah, done. So actually, I wanted to start with something which I was facing today since morning. No, yesterday I posted something in LinkedIn. The things we were
ओके.
discussing about this providing active care, no, in physiotherapy. How we should be providing active care in physiotherapy, and we should not be making the patient dependent on physiotherapist while treating. We should not be making them dependent and habituate on passive modalities when we are treating.
ट्रू.
So,
ट्रू.
but I received a huge amount of hate in that LinkedIn post about
ओके.
this active care. Then I got to know that this concept of passive modalities, no, to treat pain or relieve pain, it is not actually a local thing. It is a global thing.
डेफिनेटली इट इज.
The physiotherapists all around the world, no, Australia, South Africa, everybody had an opposing comments about this. So you are working as a consultant physiotherapist, right?
या.
Yeah, so you have been treating patients since you have graduated. So, how do you look at this approach of passive and active in India?
Basically, in India, if we try to change the atmosphere of the general surrounding of the patient, that this electrotherapeutic modalities are not the cure of your problem. Huh.
Mm.
We have to make them understand. We have to analyze their situation and treat according to them. We have to
Okay,
treat.
so now the most people, no, most students, the questions they are asking about this passive and active approaches, when the patient have already went for physiotherapy, getting physiotherapy treatment to some other physio, and they have provided ultrasound, IFT, software, whatever it is, or release, right? So whatever it is. Now when they are coming to you, the patient themselves comes in the mindset of asking a passive treatment, right? So they want
Yes.
passive treatment, passive approach. They want that muscle release or they want that IFT because they have been stimulated in that way. So when that pain comes, no, they want you to treat in the same way. So that is a common question that is asked by fellow physiotherapists. So what is something which you have to tell to them when the patient themselves comes and asks for a passive care?
Okay. First of all, we have to explain them that the problem which they are suffering from, no, it's not to be cured by the machines, because we are applying the machines to cure the pain. Okay, but if we are not providing the active care or the exercises or the rehabilitation program, the problem will reoccur to you and you will suffer again. So when we make them realize that it's not your problem, it is the problem that your musculature are weak. It's the problem that you are not rehabilitating properly. The machines will that cure your pain at a limited time period. It will just give you a temporary relief. So when they will understand the thing that it's just that these machines are giving a just a relaxation or just a massage type feeling, when we are feeling the relaxed, when we are getting the happy hormones secreted, that much period of time we are getting the relief. Yeah, but the exercises and the musculature strengthening and everything, rehabilitation will give a long term effect which will improve their life and living standards. This we have to make them realize by our communication, our consultation, and in between the treatment sessions, that yes, I am applying these modalities. I'm not saying that I will not apply it. I am applying the modalities, but this modality will just help you. Just
Okay.
help
Okay.
you to this help you to just to relieve from your pain for a small period of time. But if you are not rehabilitating and exercising the properly, this pain will reoccur and you will suffer again.
Mhm. Right. So actually, to the audience, I want to ask something. Whether both of our audio is clear, people who are in live, can you guys clarify that whether the audio is good? Can anyone comment that both of our audio is good? Both of us. Can you guys hear both of us?
Yes,
Yeah,
it is.
good. Done. Thank you. Right, done. So actually, the next thing which I want to ask is that you are saying, no, the approach which we do for a patient, right? If the patient himself is asking for a passive modality, yes, I might apply passive modality, and then I have to drag them to active. That is a common comment which I got even in LinkedIn. Most of the people have told that what if the patient themselves want a passive modality, and I'm going to apply a passive modality, and then I'm going to make them understand that I'm going to provide active care. But the problem here with me is, what if that's how habit is formed, no? When you start doing something continuously for 30 days, or let's say 20 days, because when the physician prescribes IFT or ultrasound, we have faced it, no, our generation have faced it more than this current generation. The physician doesn't give us a autonomy, right? They are not going to allow us to perform a autonomous practice. They are going to write IFT for 6 days, IFT for 7 days,
Yes,
back surgery
yes,
for
yes.
30 days, right? Back surgery for 20 days. So when we get such kind of instructions from the physician asking us to perform what they are prescribing, and the patient themselves comes in the mindset that I'm going to go somewhere, I have never heard of physiotherapy, physician have told me that I have to go and see someone called physiotherapist, and the physiotherapist is going to apply what the doctor have explained me, not uh, I'm not going in a mindset of a assessment, or I'm not going to the physiotherapist in the mindset of getting diagnosed, or what's wrong with me, or what I have to do, or what I have to do for the next 15 days to avoid that particular surgery, whatever it is. Now the patient himself is habituated to go to the physiotherapist with some kind of mindset that what that physiotherapist is going to do. Now that is the first failure that we are facing, right? So once the patient is coming to the physiotherapist, if we have only 20 days to convince patient that exercise works, active care works, and I'm going to educate you that why it is important, all these things are there. But what if that when we apply that particular modality for say next 7 sessions, alternate days, let's say for 15 days or 20 days, it becomes habituated, no, that the patient receiving the first line of care from physiotherapist is IFT, ultrasound, or some kind of things which can stimulate his nervous system. I'm just going to go there, physiotherapist, I have went yesterday, tomorrow I have to go there. My mind knows that what that particular guy is going to do. I just have to go in.
True.
I have to wait. I have to go. I will go inside the cabin, and I just have to lie down. The physiotherapist is going to apply something, and that is going to stimulate my body.
Yes.
So that is how habit forms. No, when you are getting to know something for the very first time, and that is why first impression is best impression, right?
True.
You're going to go there. You are receiving something for the very first time. That is the first time he have seen someone called physiotherapist, and he have received this particular care from physiotherapist. So
Yes.
what before we can convince him to come move on to active care, we are going to provide that particular passive care for 10 days. What if that person gets habituated and he cannot move on to active therapy because now his mind is always about that particular IFT or that stimulation? How we can approach that? If we are going to start with passive care as a first line of treatment, and how we can slowly move on to active care? Do you think it is possible?
So first of all, it's not the program problem of the physician is prescribing the treatment, not of the patient also. It's the therapist who is responsible for it. Because if the therapist is graduated, even he has no clear idea about what is IFT and what and how it is working. He has just known about it that it is a machine interferential therapy, it is a blah 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 the frequency. It has some indication, contraindication, you have to apply it in pen.
Hmm.
There are a lot of parameters you have to look after, a lot of program numbers and lot of the criteria to prescribe in perfect conditions.
Mm.
Yeah. If he is not aware about such things, still he is applying that, then he is making fool to the patient.
Yeah, this is exactly what I'm talking about. In rural setup now, the patient is actually not educated about anything. They doesn't have a health education first, right? Which I am completely aware of now because I have practiced in metro city. Like I think you have been in Chennai, right? You have been in Chennai.
Yes.
Yeah. So you have worked in Chennai, right? So the difference in the Tamil Nadu alone in southern state compared to Chennai and Trichy, the patient know what they expect is different because Chennai, the kind of patients you are going to get in metro cities are people who are aware of what they are doing. They know how to Google, they know how to search for things. Now AI is there, all these things are there. But compared to the city which I am now, which is Trichy, right? The setup, rural setup, no, it is actually urban. It is actually Trichy is also urban state, but the place where I have worked now as an academician, it is kind of a rural setup where around the college campus there are n number of villages, so people are going to come from there to get physiotherapy, right? Actually it is free treatment also because it is being provided as a service in the hospital, right? So now these patients are coming, no, they doesn't have a health literacy.
True.
Their health literacy is very low. So
Yes.
when the patient comes there, they when we are providing, they doesn't have a clue about what is physiotherapy. So if we are approaching them with that particular thing of passive care, obviously they are going to get adapted, no? And there is one more thing which I have to discuss about this is about the nervous system. This 20 days of stuff, no, where the patient is coming with pain, you are applying IFT or ultrasound. Have you seen anywhere so far? You have been working in different setups, no? Have you seen anywhere in India people are documenting how much dosage they are keeping in IFT?
No. No. No one.
Is it good?
Rarely. Rarely someone is doing it.
So, do you think that we are tracking anything there by applying IFT?
No. First of all, it's not about rural or urban city.
Hmm.
है ना? If we look at a rural city, na, the therapist is applying test, ultrasound, IFT. Okay. When we are moving to urban, they are applying laser, shockwave, matrix, and everything. Just modalities are changing,
Hmm.
and they are becoming expensive modalities. Sense
Hmm.
ultrasound are the modalities which cost less amount, and that laser, matrix, and all that shockwave is expensive modalities.
Hmm.
So that's why the modalities are changing. No parameters, no frequencies, and nothing is documented. But how much doses to be given of a class 4 laser to the patient, how much depth should be there, in which condition we should give for 5 minutes, 10 minutes, 20 minutes, that data should be collected from the therapist and documented. Because if not, it will harm the patient. At many clinics, it is happening that the therapist is consulting the patient and assistant are treating the patient with modalities. Hmm. Assistant may not have the idea how much long duration should I provide the class 4 laser.
Hmm.
If the time period is increased
Hmm.
or have given for more than 15-20 minutes, it will harm the patient in a negative way.
Yeah.
That should be properly documented. That should be properly understood by the therapist and as well as the assistant. That
Regarding this documentation, no, what you are saying about harming the patient, in my point of view, no, it is not just about the duration, but also actually the next thing is when the patient comes for a follow up. Let's say that there are a group of, let's say, 5 physiotherapists in OP. A particular patient have came who doesn't know what is physiotherapy, and someone have kept him passive care, and the next day when he is coming, how important is for the second physiotherapist who is attending the follow up of that particular patient to know how much dosage the first physiotherapist have kept for him. Do you think that both physiotherapists are going to treat that particular patient the same way? This is very, very prevalent in India where repeatedly when the patients are coming, no, they are tend to see different physiotherapists, even in same OP.
yes.
So how important is it to have a
First of all,
follow-up?
uh, no one is following this documentation. Okay. No physiotherapy is documented that I am giving this modality as this intensity and for this duration. Now, so it will be very difficult for the another therapist who is just treating the patient now. Okay, so it's the therapist's fault who is not documenting the thing. Even it's not about the therapeutic machine. It's also about the exercises. How much
Mm.
load is there? How much intensity you are giving? How much weight you are applying? How much repetitions? How much repetition maximum you are giving?
Mm.
It is short lever exercises or long lever exercises. It should be documented from the therapist.
Mm.
है ना? In either it's passive, either it's active. It should be documented well.
Mm.
So that he if he is referring to another therapist or another physician or another orthopedic doctor, he should know what's going on with the patient.
Mm. And there is a discontinuity of care now. The
Yes.
physician, sometimes the patient might come to physio directly for the as a first line of treatment if they are aware of the physio that it is a musculoskeletal condition where the patient have that mindset of going to the physiotherapist because somewhere they might have heard that physiotherapists are meant to treat this kind of conditions. Maybe
True.
word of mouth feedback or something like that. Sometimes the physio referral is coming from somebody else, right? Some other healthcare professional. The thing here is, like you said, no, if that particular person is not aware of what is going on with the patient when he is going to visit physiotherapist for a long period of time, it is actually disrupting the whole process of this management itself. No, that multidisciplinary approach is actually getting disrupted.
Yes.
I, I feel that India is far away from achieving that.
No, India is far better, I guess, but still the therapist and the upcoming graduate have to be so much sincere about their work and should learn the documentation and learn to how to prescription of the modalities and the exercises. है ना?
Mm, mm, mm.
Prescription is very much important nowadays. Either it's electrical or is the exercise-based rehabilitation. It should be documented and it should be kept very uh, aware, known to the patient that we are giving this machine or this exercise at this level. So if you
Mm.
ever visit someone other therapist or doctor, he should know about it.
Yeah,
Yeah.
I think it is. How far are we from achieving that I mean, complete and nationally? Do you think that we can make physios in India to adapt to something they can do now? There is huge things like we have AI now, right, which can help us do things faster. The whole world is moving towards AI, but physiotherapists are still doing everything in a way that it is not actually matching their profession. They are not. I feel that we are not adapting to the technologies. We still use Instep. We still use goniometer. We still have a subjective way of assessing everything. We don't
Yes.
document. We don't find an easy way to document. All these things are uh, affecting our profession to going to the next level, right?
Yes. The documentation is very much important. And as you're talking about the technology is growing very fast, and we are still using the volumeter, the inch tape, and everything to measure the all the diameters of the human body. That
Mm.
should be that should be. There are many applications which are showing the angles and which are giving us idea about the posture. We can say we have to use it. Even I am using much few of the apps for goniometry and posture evaluation. So yes, we can do it. Physios are improving, but the only thing is we have to make them stimulate them. Like they are applying the machines modalities to stimulate the muscles. We have to stimulate them that you are doing something wrong.
And
The,
how hard, how strong the stimulation has to be for a physiotherapist to start documenting cases.
no, it's really very hard because it's not a very fancy job to document. We have forgot to write documentation, writing, and we are not doing such things in your daily routine.
Yeah.
That's the main
So
issue.
we are
And
not
we
tend
are
to type everything, but is it actually better if we give everything automatic? You just have to click it and you have to
yeah.
manually do it, but in
Even
a
that
better way.
even that will be hard for a therapist because he is still not aware about the what intensity will work or what frequency will work and which program number will work for that patient. They
Mm.
have to learn if they are only prescribing the electrotherapy. They have to learn electrotherapy in very depth. I'm
Uh,
not saying the electrotherapy is the wrong thing. It can be used, but you should have an in-depth knowledge of the things. If you're only using that, you're not prescribing exercises. If you are good at electrotherapy, give it, but you should have at least a good depth knowledge that you are providing to the patient,
Mm.
and please
Actually, in my
document it.
opinion, no. Actually, I'm good to hear your opinion, but in my opinion, the therapist should not even go to electrotherapy. In
Yeah,
my opinion,
that's
no. I
that's
think we don't want to have electrotherapy as a subject to learn. In my opinion, because what we have to learn is how that particular thing is completely affecting the pain signs. That is the argument I will have, because even when I have to explain
that
something
we can
where, let's
that
say
we can
the whole
yeah.
concept behind applying electrotherapy, no, let's say that patient is feeling pain, right, at a certain intensity, right? So now I'm gonna apply some other stimulus which will pass to the brain faster than the pain, and this stimulus is stronger than the pain stimulus, right? So now this stimulus is what the brain is going to perceive, and pain is not going to be perceived by the patient. This is actually the theory behind the counter irritation, no? But the problem here is why electrotherapy without documentation is going to fail is when the patient is continuously receiving IFT at a certain level. Yes, the pain will not be felt for a short period of time because some other stimulus is being felt. But the problem here is at such particular intensity. Let's say the patient is receiving a X amount of stimulus, right? Now, slowly, the patient will not feel pain because this stimulus is stronger, but nervous system, no, it has a very good way of adapting to whatever stimulus it is being given. It will
True.
adapt to the pain also at a certain level. It will adapt to the intensity which electrotherapy is giving. Now, at some point, no, patient threshold for this new stimulus, electrical stimulus, is going to keep on increasing. At some point, the patient will need higher amount of intensity from electrotherapy because pain is body is also adapting and coming. We will never go to a level where the patient will actually reach the chronic pain, and will never reach the level where the patient is cured for a long term. If we are going to introduce this, so that is a
The
I'm not
only thing
getting a I'm not getting
the
a
only
complete explanation of why we should practice electrotherapy.
so the only thing I want to say is we can't remove the diclofenac and aceclofenac from a medical store.
Mm. Yeah.
That's the
Then
only thing. We can't remove the diclofenac from medical store because in India we are so much not aware about our human body system. We just go to medical store and ask them to give a painkiller. They will give a diclofenac, aceclofenac to us.
mm.
We are not aware about how much dosage we should take of the medicine. So people are not so educated, not so caring about their body. If they are having a pain, they can tolerate it. They can take a painkiller. The same thing goes with the electrotherapy. They don't want to exercise or rehabilitate anything because it will give much more pain to them. It's better to take electrotherapy. They are not aware about that exercise is giving them a long-term relief. So it's very hard to change the psychology of the patient as well as the therapist because therapist is working in that way because the upcoming patient is demanding the thing. It's very hard for a therapist to decline the patient that I'm not this the modality will not give any much more benefits to you than relieving of 2 to 3 days. Okay, so therapist is thinking about it. He can't lose a patient, and
Mm.
patient is demanding electrotherapy. Therapists don't want to lose the patient. That's the main thing. The electrotherapy is not going anywhere. It will stay for a longer time.
So electrotherapy is going to be my nightmare for the whole life, I guess.
Definitely, it is.
It is not going to be. I feel that it is more dangerous than polio. It is polio of physiotherapy, I will
It
say.
it's
Electrotherapy is
it,
something which we have to eradicate, but it is going to take a very long time, I guess.
Definitely it will take a longer time, but it can be good for someone uh, who is having a proper knowledge how to prescribe it. It can
Mm.
be helpful for few people, not all the people, but few of the people can benefit from it.
Okay, as someone no like me who is not interested in learning electrotherapy, how do you convince me that it works? That it
Okay.
can work?
Just like I'm saying that aceclofenac and diclofenac cannot be removed, na?
Yeah. I
Um,
understand what you're trying to say, but I
yeah,
think there is a much larger scope for us than even if we are
people in
able to do it in a proper way. I feel that we have a huge gap in how we are applying it because the learning, the education system, all those things. Though I have been working as an academician for the past 2.5 years, still I feel that whether we are passing on the information that is really needed to operate electrotherapy, I don't think it is happening. Students are not learning electrotherapy in a way that it should be learned.
true.
Now I have this knowledge, no? Patient, when a physiotherapist is teaching a junior physiotherapist who is going to become a physiotherapist and treat patients in future, I should be able to give him a complete knowledge of what works and what doesn't work and what is going to happen behind electrotherapy. All these things, no. If it is passed on in a better way, then physiotherapist, the younger physiotherapist, no, they can actually pursue things and they can understand and they will know that okay, we have to learn much more about this and we have to know what is indicated and what is contraindicated. Do you think that that is happening? Have you seen younger physiotherapists who are coming out, the recent passed out students, and how much is there awareness about electrotherapy in treating pain?
The most important thing is when the therapist is graduating from the master's or from the bachelor's, either they are opening their clinic, either doing the home visits directly. So they are not experiencing enough to know about what's going on in all over the cities or in the another clinics. That's the main thing. They have encased themselves in a circle. Nah. The circle is filled with electrotherapeutic modalities and a few exercises which are prescribed in the book. So they are just revolving around it and prescribing those things. So when they are ready to explore themselves, what they are ready to explore the science behind the exercises, science behind the exercise physiology and everything, even science behind the electrotherapy, they will get to know about the behind the scenes of everything. And when they will aware about it, they will start changing themselves by 1%, 2%, and carry on. Huh. So it's not impossible to change. They have to change themselves slowly. They have to educate the patient and they have to understand how these things will help to the patient. Even my journey, I have started with a clinic which have few electrotherapeutic modalities. I was working with the same thing. But now, as I look after the things, I am very much in a space where in my mind, I'm not using any modalities. If it's patient requirement, psychology, I am providing it to the patient. But in my mind, I'm not trying to treat the deformity or the pain from the machines. I'm trying to treat the pain from exercises, not from the machines. If the patient demand, yes, I will give it to them. But in my mind, as a therapist, I am providing the proper exercises, the proper education, the proper uh, home care to them, so that they can cure the pain, not the modalities. Because the patient themselves have to cure them. We
Okay,
are
then
just giving them guidance.
how much time it took for you to understand that this is how it should be, and how much time it took you to mature in this particular thing? How many years? And how many
Well,
years you had been getting a mentorship from someone else?
we can say in the starting of the my clinical journey, first 1.5 year, I was uh, prescribing exercises as well as giving the electrotherapeutic modalities in the same manner. That this will ultrasound will help you in tennis elbow, or the TENS will help you in cervical radiculopathy, even like that. But as I'm getting the idea about how the biomechanics is working on the human body, how the gravity is working on the human body, so when I am getting the idea, I am trying to find out the root cause of root cause of the pain in the patient and treating the root cause with the help of exercise therapy and um, many things like still I am using MFR. It's not the wrong thing for me. So yeah, I am trying to find out the root cause which is giving the pain to the patient. So
Uh,
treating the things
so,
now
do
is
you think that
easy for me.
all this awareness which you are saying, no? Do you think that these things, junior, no, who a UG student who is passing out now, do you think right
Mhm.
after the undergraduate, the student will be ready to take on the world with
No,
patients. So how much
No,
time do you advise for someone to go and work somewhere else to gain knowledge?
ex- explore the things, explore the physiotherapists who are working from last 10 to 15 years.
Mm.
Understand the process, how they are working. Are they relying their treatment on the passive modalities? And if yes, then how they are applying it. If no, then what is the science? What is the science they are working on, and how they are convincing the patient to not use electrotherapy?
Mm.
You have to gather the knowledge from a lot of therapists and then mix it up, because
Mm.
you have learned a limited amount of knowledge from the uh, undergraduate degree.
Mm.
Huh? So as the books and the clinical job, both are different things. So when you are taking experience from the multiple therapies and get going to attend the workshops, anything like that, uh, so you are gathering the information, and which information is useful for you as a clinician. Apply them to the patient.
Mm.
Take the good things from them, and if something is not good for you, just don't use it.
Actually, we can observe what is happening around the
Observation is
clinic
important.
when we are
Observe.
working for someone else. But we have a culture now where third year, I mean final year or internship student starts going for house visits, right?
Yeah,
Do you think that they are ready for it right after they are coming out of college?
they are not ready for it, but still, I can say that's a good thing. And that's
But it
properly.
involves a
That's
lot of trial and error, trial and error. No,
yeah, that can be, but it's I can say it's a properly illegal thing and should not do it. But the thing is, they don't have any electrotherapeutic modalities at that duration of time when they are
okay,
going for the home visit. They are
okay.
relying on the exercises, like even a PKR patient, they are relying on the exercises.
Hmm.
है ना? So if when they are not using the electrotherapeutic modalities, they are relying on the exercise, and that will be beneficial from them to understand what's going on in the human body. That
If they are
the need,
practicing better in that way, then it is good.
yeah, the knee is still in the inflammation. Should I give a high doses of exercises? Should I decrease the repetition? Should I increase the repetition? Should I give a external resistance to the patient or not? That will grow the therapist as a person who is aware about the exercises and patient conditions.
Okay.
Yeah, that
So,
can be used.
so it involves a kind of active learning.
Active learning, definitely it is.
Yeah.
And when you start prescribing exercises to your patient, you will yourself understand that after seventh repetition, the patient is getting fatigue or getting uh, the muscle, the pain in the muscles. We can say.
Mm.
So that can be the optimal dosage for the patient. It's not 10 into 3 repetition, 10 sets into 3 repetition into 10 3 sets into 10 repetitions. It's not always like that. If patient is getting fatigue in the seventh repetition, we should stop there and understand the strength of the patient before giving the prescription. So every individual have a different strength. We should understand it and then work on the patient.
Okay. So one personal question. Before we ask, getting doubts from the participants who are actually watching live, I want to ask that: have you ever used AI or ChatGPT in your
Yeah,
practice now? Have you adapted in any way?
definitely yes. I'm doing it.
Okay, good. So, in what way it is helping you?
Uh, you can use a lot of prompt through ChatGPT to understanding the biomechanics of the conditions. What
Mm.
if take example of a tennis elbow.
Mm.
When we are giving a proper prompt to the AI, that what can be the biomechanical causes of the tennis elbow pain, it can give the answer that there is inflammation or lateral pain, right? Anything like. But when we are giving a proper prompt, it is giving the weakness of the shoulder muscles,
Mm.
overusing of the wrist muscles,
Mm.
few antagonist agonistic imbalance are there.
Mm.
It's giving a proper example where you can learn from the things, and then you can treat the patient, because it's not the local thing. Tennis elbow is not a local pain. It's a global pain. You have to treat the shoulder as well.
Mm.
You have to treat the spine as well for that.
So,
So
you
yes,
have adapted ChatGPT in your practice now.
yeah, yeah, yes.
Right, right, right. Oh, good, good. So now, before we wind up, I want to get some questions from people who, if they have been following us, if they want to ask any question, you can leave those questions in the comment. We will answer it. Actually, I got one question in between from one of my student. Actually, it went about yes. So he asked how you are documenting. What is the way that you are documenting your cases? He was asking that. So if a patient is coming for low back pain, do you have a specific documentation way of documenting different cases, or do you still have that our traditional soap method?
So not working with the soap method because I have designed my own thing that I have to assess the few aspects of the patient if it's coming with the lower back pain.
Mm.
It has a few tests we have learned from our undergraduate degree. There are few tests. There are few postural conditions. Work on the antagonist agonist thing, which muscles is working, overworking, which muscle is underworking, which is underused. If the patient has proper breathing, how is the diaphragm working, how is the pelvic floor is working, how the lower muscle strength are there, is
Mm.
the foot, hip, and the lower back is integrating properly, working together or not. There are a lot of aspects to document the patient.
Okay, right. So it depends on the case, right? It
Depends
is
on the
not
case.
a static notes. It is going to
Yeah,
be depending on how you are testing the hypothesis and how you are documenting it, right?
yeah, because
Right. So we got
every patient have a different history and different root cause of the pain. So assessing and treating in the way of the patient requirement is the much better thing I can say.
done. So I got one more question. If we are actually going to use electrotherapy, so how are we going to convince patients to do more exercises? And where should we line a draw? Where should we draw a line that this is where I'm going to stop electrotherapy and start exercise? But I don't agree with that. I have told you that in my book, I'm not going to start at all. The line is very stronger there. If you are coming to me, I know who my patients are. I'm only going to give you the active care because I have, I'm planning to launch a clinic. I
Great.
have not ordered a single piece of modality or a single piece of equipment which is going to be involving a passive care. So I want to ask you, where do you draw a line, and where do you go? At what point you have to convince the patients that they have to be involving in more of exercises when it comes to rehab and not the passive modalities?
Uh, Patient will look after another patient and they will perform the exercises. If you have a clinic of where you are treating 4 to 5 or 7 patients in a single time period, when the new patient is watching other patient doing exercises
Mm.
and they are and patient you talk with each other. How are you? How was your pain? Is it better now? And when they get to know that the last patient is improved from the clinic, so the therapists have done something good for the patient. So if they are exercising, they are rehabilitating the patient. Look at them, and automatically, when you feel that the line has been crossed, you shift that patient to the exercise therapy.
My
Or
question is,
you
don't you think that it falls the same for electrotherapy also? That the patient goes and get electrotherapy and come back, and they are going to tell other patients that I got electrotherapy from that particular clinic, and they are going to keep on lining up to that particular physio to get that passive treatment. It works both way, no?
definitely it will work in the both way.
Yeah. So the line which we have where we have to draw is if you think that the patient got addicted and they got a central sensitization that they need that IFT stimulus, constant
The
stimulus. That is like actually today that was my script for the next reel. Actually, I'm posting reels now. The thing which I made it is once the patient gets adapted to IFT or something like that, it is like a dog getting conditioned to a bell, right? When the patient
true.
comes for a load, when the patient comes because the load have been exceeded, and now the patient got an injury because there was a overload in that particular tissue, and now he is feeling pain, right? That is actually a day-to-day process. If a physio is not actually educating the patient that it is something natural and that will go away by itself, and if you feel that his capacity has to be improved so that that pain will not return, then we have to give him that active care, right? Now when the patient is not intervening in this process and if we are applying passive care, now remember this, when the habit is formed now, in the next week the patient is going to go there. On particular day of the week, the patient will get overloaded, the pain will return. That is a conditioning, like a bell ringing. When the bell rang, no, the dog will get saliva. Same way, now the bell rang, patient knows that once I got this pain, last time the physio treated using IFT, the patient will come to IFT only. And we are just habituating them for that particular passive care. It is in the
The
hands of the
therapist must
therapist.
know. The
So
therapist
once
one
we,
must know where to stop. If we
yeah,
are not
we have
talking
to know.
about electricity,
We have to
we have
know.
to know that if we first thing we have to know we have to start or not. It should differ from patient to patient.
Mm.
There are a lot of
So,
patients in which we are not. I am not using any modalities. I know that they are my patient. I am very comfortable with them. I can explain my thought and process of treatment. So I
yeah.
don't apply the modalities. Few patients are there who can be convinced in 1 or 2 sessions. So I
Mm.
just draw the line of the 2 to 3 sessions and then they convert them to
Mm.
exercise therapy. There are a lot
Mm.
of patients more who they don't have any idea and they don't want the exercise therapy. So we should know our limits and draw a line when to start and where to end. That's important for a therapist.
So to follow up with that, no, now the next comment, I mean, the next question by the viewer itself is lining up with that. If you are going to apply it, at what situations actually you are going to administer electrotherapy? Is it only
What is
because
the
the patient is asking for it, or the only because the patient is declining that he doesn't want exercise therapy, or is there any other situations where our learning itself is asking us to perform electrotherapy rather than going for active care? Is there any
no,
scenario where it is not because of patient?
no, it works in both ways. There are a lot of things where electrotherapy can help out when we
Mm.
can. That's the situation where we can't apply the manual therapy, or we
Mm.
can see the patient is very much emotionally weak or psychologically weak. Uh, he could not bear the things. In that way, we can apply the electrotherapeutic modalities just to psychologically make him down, make him calm, and everything. When we feel that he is now okay and overcome the fear, overcome the pain a little bit, we can shift to exercise.
Mm. Okay. Right. So the next question, no, it is actually again, is it fair to say patients coming in with demands of electrotherapy are just lazy to do what actually works and which is proper exercise? Is it
They are
because
not
the
educated.
patient is not performing the exercises because they are lazy, so they are asking for electrotherapy? Is it like
No, they
that
are
or
not. They are uneducated about it.
okay?
They may have an episode from the earlier therapist. They might have applied them the electrotherapeutic modalities, or uh, they have received some good amount of relaxation from the modalities. So
Mm.
they are asking us to apply the things. No one is that much of lazy or no that much of insecure about themselves. Everyone can do the exercises. Even
Okay.
we can use the progression and regression of the exercises to perform the
Mm.
things. So it's not the patient thought; it's the combined thought of patient and therapist, and how the
Therapist.
therapist convert the patient. Yeah, both way. It's a
Right.
both way thing.
The, if the opportunity was provided because everyone wants to be pain free. No
Definitely.
one is lazy enough to not accept exercises because if they know that they are educated that it is going to work, they will definitely commit to it. They are not lazy. You, as
Yeah,
a physiotherapist, if we are providing it as an option, definitely the patient is going to choose the long term now. And now
definitely.
in this generation, I would say that we have moved on to natural foods, and everybody is aware now that fitness is important, and they have to go for this electrolytes and all those things instead of packed carbonated drinks. People are moving away to
True.
organic stuffs. Exercise is an
Yes, yes.
organic thing where we are positioned at a very good stage where of life that people are aware of it because of net and all those things. So it is our duty to implement in a better way,
Yes.
right? So if we educate them, they are gonna definitely do. They are not actually lazy, right? So
to
next
to
thing is
educate
when do we
first
decide?
thing
Yeah, yeah, yeah,
to
sir,
ed-
yes, sir.
to,
Continue.
to educate the patient, the therapist should be educated first.
Yeah. Mm.
Yeah, the thing is.
Okay, I'll come back to that after this. Right. So now, hello, sir. How? When do we decide to terminate physiotherapy? Is there a quantifiable measure where we can suggest that the patient can stop coming for our service?
I didn't get the question. Can you repeat it?
The question is, when do you terminate physiotherapy? When do you tell the patient that physiotherapy care is done? You can carry on with your
Okay.
life.
It's mainly based on the demand of the patient, what they want.
Mm.
A patient come with the knee pain. He's complaining about it. I can't climb the stairs. I have my room at the second floor. I can't climb the stairs. It
Mm.
is the demand of the patient. And
Yeah.
when you are able to cure the things, he is now climbing the stairs. He is doing the things well. When
Mm.
you satisfy the needs of the patient, that's the point where you can say that we are done with our work and you can continue with the exercise at home. And if
Yeah.
in case you face any problem again with the things, you can visit us.
Yeah. The funny thing about this is no, the assessment that we are following, right? It doesn't ask what is the goal of the patient.
True. Goal is the much more
The thing
important
which
thing.
you told, no, even that didn't strike my mind when I read the question. But the thing is, patient is not coming to you just for pain. If it is only pain, the patient will not come to you because he knows how to manage it. Right? There
Definitely.
are a
Body is
lot of ways
adaptable.
because as a physiotherapist, we are also human, no? We face pain in our day-to-day life. When the patient comes to you, you are only asking about pain, but we are not asking about how that pain have limited him in some way that pushed him into physiotherapy to
So
come
the
for physiotherapy.
one more thing is that the human body is so much comfortable for adaptation.
Hmm.
The patient will visit a physiotherapist or a physician at the stage when he is totally saturated or nearly saturation. No,
Hmm.
patient doesn't come that I have a just elbow pain and I am visiting you. No, he has tried all the things like medications, like applying some ointment, doing some religious stuff, that giving the any. We are in India, we have a lot of things to do about
Yeah,
it.
yeah.
Yeah, giving a massage and everything. They have tried a lot of things. Then they are consulting us for the pain. Yeah,
Hmm.
so the body has adapted already with the pain, and now
So
patient is
most often the
saturated.
patient is coming to us in a chronic stage.
Chronic is definitely. Few
Hmm.
of the patients are very much educated and aware about it. They are visiting us in the acute stage. Other than that, everyone is coming in the chronic stage where body has adapted it so drastically.
Hmm. Yeah. So once the patient is able to do the limitations which he told when he met you, if you have made the patient to do that, that is the end of our service.
Definitely, yes.
And I would add that once you have done that, the patient will not get that back for 99%. We cannot say the person will never get re-injury, but you can assure him that once you are doing this particular protocol as your day-to-day life, and this is how we are going to educate you that if you are going to have this as your practice, then the chance of re-injury is less.
True.
Not zero, but less. Right? So the next question is, do you rely on any software for documentation, especially in your clinical setup? Do you follow any software setups for documenting?
Yeah, I use a application which have few angle measuring stuff. I
Okay.
used to measure the angle of the joint range of motion or anything like that, and
Okay.
posture evaluation
Hmm.
application is where I use it.
So you are doing that for examination purpose, not for
Examination
complete
purpose.
documentation.
No, 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 not for
No, you are not doing
documentation.
for a complete documentation of a patient. For
No,
softwares.
yes, not from the software. Documentation should be in my word that I can understand it. It should not be in the format which the software is suggesting me, because it's my practice and I'm working in the my way of pattern.
Hmm.
So the documentation it should be in my way that I can understand it very well, and I just change it whenever I want. It's not a software based thing for me.
Okay. So it should not be like something which you have to follow. It should be like your assistant that you are gonna do something which should be a free flow, not in a way that the software wants you to do.
Yeah, it's not about assistant or anything. It's about how I want to understand the things better. I don't want to rely on a chart sheet which have n numbers of criteria to fill it out. I have my own criteria which I am going to fill.
Hmm. Done, done, done. Okay. I'm asking a lot of questions about documentation because I'm doing something which
It's
I will,
it's
which I
important.
will
It's
explain you
important
later.
thing.
Yeah.
Yeah.
Right. So, any other questions, or are we winding up? Anybody else want to ask anything for next 10 minutes?
Because relying on the software or a proper uh, demographic questionnaire of documentation, it's not good in my way, because the question paper or the documentation chart or the software designed from the person, another person. He may have a different thought process. I have different thought process. I'm treating patient from last 6 years in a different way. He's treating in a different way. So the what I am observing in my patient and what I am assessing in the patient, what I am planning for my patient, it should be in my way.
Mm.
So everyone have their own way to treat, assist, and retreat and assist. Because it's the process. Treat, assist, retreat, assist, retreat.
Okay. So what if the software is just a blank space where you can just enter what you want and it will be digitally documented? Is it
Yeah,
will
it can.
will will that help you?
Yeah, definitely it will.
You just have to write it out. What are the things which you are seeing, and it will be just a blank space. You can just write it and document in the name of the patient so that you will be able to see that same documentation later, rather than giving a
Yeah,
long format of what everything has to be filled in that older way, traditional way.
definitely yes. Because whenever I look at physician is prescribing, he is not prescribing a lot of charts or a
Mm.
proper questionnaire method or proper assessment pattern. He is just prescribing the things that
Mm.
he's a fever, he's a flu, he's a do, and the
Mm.
medications. That another
Mm.
physiotherapist or another physician can understand it properly. He don't have
Mm.
time to read all this when he is referring to any orthopedic or any other physiotherapist. You don't have time to read all the things. It should be short, simple, so that everyone can understand it.
Okay, done. It should be either a blank space or it should be in a way that you can dynamically adapt.
Definitely.
Yeah. So the next question is, what do you feel about poster assessment and evaluation? Do you think it is overhyped amongst the clinical scene? Or do we need more detailed and intricate assessments of posture? So do you think the softwares we are using for assessing posture is good enough to be compared to gold standard, or do you think it still has to evolve?
They still have to work. Still have to work
It is not
because
as good as
because
3D capture system, no?
no, it's not as good. But posture is a really hype thing.
Hmm.
Posture is really hyped. But at some places it can help, because when we are looking at is that body works with the gravity.
Okay.
है
Hmm.
ना?
Yeah.
Body gravity play a major role on the human body. So
Yeah. Yeah.
we do body is moving as full freely and efficiently with the force center of gravity and the proper base of support or not? Do your base of support from your foot is proper or not?
Hmm. Hmm.
Is your body perfectly working? I'm not saying that there should be a good posture or bad posture, but the faulty posture should be noticed. That will give you a basic idea of assessment that this things may have a fault. Then you reassess it from your practice knowledge and your documentation, the assessment and everything, and special test you can do it. But it will give you a brief idea about it that there is something wrong on it.
So do you
This
ever
joint
advise
is
that
not
the patient
properly
have
set.
to change their posture, or you will never do it? Or where do you line a draw a line that it is not about posture?
It's not about posture. Definitely, there is nothing as called as good posture or bad posture. Every human body is different.
Hmm.
It's about what their body is adapted to. If they are adapted in the wrong manner, their joints are not centrated, or they have any uh, overpronate food, overpopulated food, like that things. That should be captured as well.
Okay. Done.
The-
So the next question is about how to write patient goals in documentation, which I think I will explain. Patient goals is actually a subjective thing because you are asking to the patient. So subjective examination should have the column for patient goal, right? So it is not something which you are going to draw. The patient is going to tell what he is expecting from you during the treatment session. So when you are writing patient goal, it is going to be when you are asking the patient what is the expectation that he is having about the sessions which you are going to have with the patient. So it should be in the subject examination. So any other questions, or
Yes.
we are gonna wind up? Anybody else? Right, sir. Thank you so much for doing this.
Okay.
So
Thank you so much.
actually, in a week, I think we'll do that recorded podcast, which
Sure.
we'll definitely have. Right? It was always very nice to have a conversation with you. It is like somebody like all of a sudden having such conversations with someone, no, to get those insights. Someone who can tune us in a way. I
The
think it
only
will be
thing is
helpful
that,
for, yeah,
as we are discussing in the whole live session, when we start sharing our knowledge and our experience, maybe the young ones coming in the field will get some information about it and they can change their perspective.
yeah, yeah. I think I will upload it in YouTube and share the link.
Sure, we can.
Though we are gonna do the podcast in an official way, I feel that even in between sessions, I was thinking, these things are very very insightful, and we are not gonna share this live thing. So I feel that it deserves to be downloaded and shared with the fellow community, I guess.
Definitely.
So what is your next big plan, sir? What's the goal in
Next
your
week,
mind now as a
there are a lot
physiotherapist?
of goals. There are a lot of goals because,
Can you share
because
anything about it?
I'm at a stage of my life where a lot of things are going in my mind and working as a aspect of clinician, as a aspect of a family member. A lot of things are going on.
Okay.
Yeah, so it
I
will take
think
time to
I think you have
take
never
time
been
to
in an
choose the.
academic. I think you have
No,
never been in
I
an
never.
academic field, right?
No, I have teach students during the COVID sessions, online session I have taken, but not as a academician.
I think you would make a great teacher.
I also think so.
Yeah, you are?
I also think so.
You think so? Then why you haven't done that? Do you want to join as
No,
an
I'm
assistant
doing.
professor?
I'm doing good as a clinician.
I think I'm coming to your field, I guess, the domain, right?
Yeah, you are coming definitely. Yes, yes.
Yeah, tomorrow is my last day as assistant professor.
Wow. That
So
then
yeah,
there
so
should
there
be
is a phase
therapy.
where 2 more months is there where I will become a complete clinician.
Yes,
There is two more months in between, but tomorrow is the day I'm gonna uh, wind it off as
okay,
academician, I guess. But I will still teach. So I hope that we will be able to collaborate in some way in future
definitely we will.
to do something for the community.
We will.
Right, sir. So right. So I'll see you hopefully within a week to record
Sure.
a podcast. Right.
Definitely
Right.
sure.
Soon enough, we'll be if your goals are achieved or whatever I have in my mind. If my goals are achieved, we'll start traveling to each other place to record the podcast.
Definitely we can
Right.
try. We can try from there.
Done. Done, sir. Thank you so much.
Okay, sir. Sure. Thank you so much.
Right. Thank you. We'll wind up.
Good. Thank you.
Done.